Okay, this will be our review video for respiratory disorders and disease test. Okay, so as a reminder, make sure that you remind yourself about the anatomy, okay? Remember, everything about diseases comes back to your anatomy. So the pharynx is the throat, the larynx is the voice box, and we come down to the trachea, which branches out into two tubes that we call the bronchi, and then they get smaller into the bronchioles, and finally end at alveoli, which are the air sacs, and this is where the gas exchange takes place. So as we talk about disorders, you need to keep in mind what the respiratory system is responsible for. All right, you definitely need to know that upper respiratory tract illnesses are the most common acute illnesses. More people go to the doctor for these than any other thing. And there is a matching section on these 5 illnesses. And several of these are also in the scenario questions. So you might want to pause the video right here and look at this chart about the differences in the different illnesses, the cause, the symptoms, and the treatment for each one. Remember that bacteria can be treated with antibiotics while viruses cannot. And the majority of our URIs are viral. Right, you will want to remember that the best way to avoid URIs is to wash your hands. You'll also want to remember that with the flu, symptoms strike quickly and the best protection is the vaccine. For acute bronchitis, most importantly for the test, you need to remember that the treatment are NSAIDs, decongestants, and expectorants. You might want to look at those to see what type the examples that I gave you in class. You never know, that might be a bonus question. NSAIDs are ibuprofen or Advil. A decongestant is Sudafed as an example, and an example of an expectorant is Mucinex. For pneumonia, you will want to know that we have to diagnose it with a chest x-ray, and the treatment is antibiotics and supplemental oxygen. Okay, not sure if you can see that, but if you're looking at your notes, your treatment is antibiotics and supplemental oxygen. For TB, it is highly contagious. It's caused by Mycobacterium tuberculosis, meaning it's a bacterial infection. The symptoms are fever, fatigue, unintentional weight loss, excessive sweating at night, especially at night, cough that may produce mucus or blood. That bloody cough is definitely your key there, that this could be TB. Along with the other symptoms, though, remember we discussed that sinus infections can cause you to cough up blood as well if it's been there for a long time, and that's just from irritation. COPD, you're going to want to know the definition there, any lung characterized by long-term airway obstruction. And most importantly for COPD is that smoking is the #1 cause. And the symptoms are dyspnea that worsens with exertion. Remember, dyspnea is difficulty breathing, a barrel chest appearance, and also wheezing. Our treatment here is home oxygen therapy and stopping smoking. Now, they may be on other medications like bronchodilators and all sorts of things, but the biggest thing is not smoking and home oxygen. This is that barrel chest appearance. Just remember how the body is trying to compensate the lack of oxygen by changing the anatomy. But the damage is done in the alveoli, so it doesn't work, but the body still does this. Okay, asthma. The most important thing that I want you to remember about asthma is that it is caused by allergens or irritants, but most likely allergens. So just remember our diagnosis of the day about the 30-year-old that had the cat, and that was what caused his allergy attack. So just remember asthma, allergies. Bronchitis doesn't cause asthma. Okay, last but not least is lung cancer, and there are more deaths from lung cancer than any other form of cancer. I'm trying to get my screen to show the top. There we go. More deaths from lung cancer than any other form of cancer. 80 to 90% of these cases are from smoking. There are no symptoms in the early stages, and the prognosis is poor. I added this to the slideshow, but you should have written it down in your notes, so just make sure that you know all 4 of those bullet points. And then you should be good for the test. All right, thank you. One last thing, look in your notes, and you might want to remember that 90% of patients with TB have no symptoms, and you might also want to remember or look up one famous person that died with TB. We looked up several, or you searched that. There was 2 different presidents. Eleanor Roosevelt died from TB. So if you're watching this video, that will help you with the bonus tomorrow.